Hello, guys. I hope you are doing well. Today, I wanted us to discuss a disease called thrush, or what we call candidiasis. Now, candidiasis it's a fungal infection. As you can see in this diagram, we have a material growing, white material growing on a vaginal canal. This white material is organisms of Candida genus which cause candidiasis. And there are several organisms of Candida genus which cause candidiasis or what we call thrush. Now, we are going to see several species which cause candidiasis. And let's start by checking them. In this slide, we are going to look which organisms cause candidiasis. Candidiasis is just opportunistic infection caused mostly the cause organism is Candida albicans, and we have other species of Candida genus which cause candidiasis, which is Candida tropicalis, Parasilosis, Candida glabrata, and Candida krusei. These organisms exist as a normal flora in different regions of body, which include mouth, pharynx, gastrointestinal tract, skin, lungs, and around the genital system of a female. Now, these organisms exist as a yeast only, except for Candida albicans, which exist as a polymorphic organisms, meaning that it can change from yeast form to mold form. Yeast form is a cellular form of fungus. Mold is a multicellular form of a fungus. In this yeast form, as they divide to appear like a budding yeast, whereby as they divide, those buds do not detach from the mother cell, thus producing what we call false hyphae called pseudo hyphae. But now for Candida albicans, they produce true hyphae as it penetrates cell of organisms. Now, let's check on a diagram to see what we call yeast and what we call pseudo hyphae. This is a yeast organism, and we have a pseudo hyphae here. Okay, in yeast organisms, as you can see, in yeast cells, as you can see, this kind of a cell it is budding, but it is not detaching from the mother cell. As you can see, they appear as a budding yeast. As you can see, they are forming small buds here. We have another bud here. Okay, as this kind of a bud continue to grow, as you can see, this is one cell, another cell, another cell, another cell. These kind of cells do not detach from the mother cell. So, at a certain stage of division, they produce this thing we call pseudo hyphae, which are false hyphae. Now, let's look on people who are at risk of contracting this kind of a disease. We have these people we call immunocompromised people who have low immunity. We have pregnant ladies. We have young or those people who are old, transplant patients. We have a patient receiving antibiotic therapy for longer periods of time. We have also persons who are always their hands are in water. Most of those people who wash utensils in restaurants. Also, we have patients who have indwelling catheters. Catheters are those kind of instrument or devices which are inserted in our bodies. Let's check on forms and clinical signs of this kind of candidiasis. We have one form which is a cutaneous candidiasis, which occur in several areas of our bodies. In oral trash, it can exist in lymph, not limbs, I'm sorry, it is lip, tongue, gum, and palate. Also, it can exist in the vagina, where invasion of a vaginal mucosa causes what we call itching, and also that can, as it grows as a white organism, it comes out as a white discharge. For those people who are taking antibiotics, this kind of antibiotics, if you take it for a longer period of time, they do kill a normal flora called lactobacillus, which lives in our vaginas, and it produces a substance called lactic acid, which keep vagina at a low pH. This low pH suppresses growth of this kind of candidiasis causing organisms. It can also affect this cutaneous candidiasis can also affect the skin, whereby uh, it invades those areas of skin which are moist, making them to become red and appear as if they are sweating. Usually, in folds of axilla, that is in the axilla region, also in the buttocks, that is in the gluteal folds. It can also cause what we call diaparachis. The second form of candidiasis is called systemic candidiasis, which occur when candida organism enter blood. And some of the symptoms of this kind of a systemic disease is right-sided endocarditis, whereby the right side of what it become to enlarge or inflame. We also esophagitis and we have endophthalmitis. Okay, this kind of a systemic candidiasis, it can also cause what we call subcutaneous nodules, and those are the symptoms of some forms of candidiasis. Now, let's show you pictures of some cutaneous candidiasis so that you can see how serious this disease can be. As you can see, this is a kid. This is a kid with this kind of candidiasis. As you can see, how this kind of a face looks like. These are candida organisms which are invading the skin. You can see how this kind of a serious, this kind of disease, how it can be serious. Now, let's check on the next diagram. As you can see, this diagram show an anal canal. This is an anal canal with a thrush which is growing. Anal canal with a thrush which is growing. Candida organisms which are growing. Now, as you can see, you can see whitish material which are growing. These are candida organisms, guys. The next diagram, it is of mouth. Mouth, you can see that this kind of a whitish organism is growing. You can see how these kind of candida organisms, how serious they can be. Now, the next diagram is of female genital uh, organism growing around the female genital system. As you can see, this area appear red and moist. So, girls, If you see your reproductive area looks like this, please go and get a consultation from a pharmacist or a physician. Guys, let's check on other diagram. You can see this kind of diagrams, the way these areas which are affected by this kind of candida organism, the way they appear to be red. So guys, if you see your region of the body looks like this, guys, go and see your doctor. It can also affect nails. Nails, as you can see, some of people in the villages there, they have this kind of nails. They have this kind of nails. If you see your nails change your conformation, please attend an hospital and get a doctor consultation. Okay, let's see or now we can diagnose this kind of a disease. Diagnosis of candidiasis occurs, you can check it on a microscope whereby you take an exudate or a fluid from a region which is affected, then you place it on a slide and you check on a microscope whereby in this case you can see those kind of yeast organisms which appear as a budding yeast or pseudohyphae. Also, you can culture them. You can culture this kind of organism in agar called sub-Rhodes agar. You can do another test called calcoflower white staining, whereby you take a fluid from those regions, then you put a you put a stain called calcoflower. After putting that kind of an, you check in a microscope whereby you can see those kind of a body yeast or pseudohyphae. There is another test which is called jump tube test, whereby you put you assemble in antiserum, a serum which contains antibodies of this kind of organisms. Then you incubate at that 7 degrees Celsius. In this case, this kind of a test differentiate Candida species from Candida albicans, whereby only Candida albicans can form germ tube. Let me show you a picture of a germ tube. Okay, here we can see this kind of a diagram. This is a germ tube. This is a germ tube. As you can see it is a germ tube. You can see this kind of I've labeled here. This is a germ tube. This is a germ tube. And this is only Candida albicans can form this kind of, and this differentiate. If you see this kind of a thing, you confirm that this is the cause organism here is Candida albicans. Let's check on another. Let's check on how we can treat this kind of a disease. In oral or cutaneous candidiasis, we can use drugs such as fluconazole for treatment, or what you call itraconazole or voriconazole. That is for oropharyngeal or esophageal. That's oral candidiasis. For skin infections such as nails or other areas of the body, you can use topical drugs such as nystatin, clotrimazole. For vaginal candidiasis which affect your vagina, you can use drugs such as miconazole, fluconazole, or clotrimazole. For mucocutaneous candidiasis, also can be treated using ketoconazole drug. For systemic candidiasis or that kind of undisseminated candidiasis which has disseminated to other organs of the body, you can treat it using avotericin B or fluconazole. Something which I want you to know about candidiasis, more so this kind of systemic candidiasis, once it enters your body, it can affect any organ. And if it can affect any organ, you can imagine if it enters your brain and affects your brain. It can be dangerous. It can kill you, my friend. So guys, that is end of our lecture today. I want to urge you guys to subscribe to my channel and follow up. I love you guys. Goodbye.